Centrastate Center.
Hello, everyone. I'm just waiting for people to join in. So I will be starting probably around 11:05. So we're just going to wait until then. Hi, Kalpana. Nice to see you. Hi, Nilesh. Nice to see you guys. I'm just waiting for some more people to join in, and I will be starting around 11:05. Those of you who are on, can you just let me know if you can see me well and hear me well, please? Hi, Rajashri, Sandhya. Hi, Pratibha. Nice to see you guys. Just send me a thumbs up if you can see me and hear me well. Got it. Hi, Mangal. Mangal, I heard your talk, so I hope I can live up to the standard. Few more minutes, guys. Hi, Dhana. Hi, Meghna. Hi, Varsha. Sorry, I'm looking at the other computer to, when I see those comments. So, I'm not looking at the camera, but nice to see you guys, and thanks for joining. Those of you who have joined now, just to let you know, we're going to be starting in about 3 minutes. 11:05 is the time when I've been asked to start, so that we can have some more people join in. Hello, Bela. Hello, Beth. Hi, Ratna. Happy to see you guys join in. Thank you, Ratna. Hi, Ellen. I wish I could see all you guys. It would have been so much better. But it is what it is. Two more minutes to start. I'm just waiting for some people to join in. Hi, Vidula. Hi, Anagha. I know it's a Saturday time to relax, and this is a little bit of a serious topic, but thank you so much for your time. Hi, Shalaka. Thanks for joining. I guess another minute. Hope you guys can still hear me. Almost ready to start. Thanks, guys, for joining in. All right, I think I'm going to start. Hello आणि नमस्कार. माझं नाव Poornima Deshmukh. I will be talking in English today because there are a lot of people who might be logging in who are non-Marathi speaking. So I think speaking in English would be better. Uh, I'm going to start by introducing myself. I am the chairperson of the Department of Anesthesiology at Centrastate Medical Center in Freehold, New Jersey. I have been in practice for about 16 years now at the same place. And I was asked to talk today by Marathi Vishwa, and I would like to take this opportunity to first thank them for this opportunity. And I think it is my duty to share my experiences on this platform just so I can help people with their decisions in the future. So like I said, I'm the chairperson of the Department of Anesthesiology, and I was asked to speak about my experiences during this COVID period, during this pandemic, when it all started, since I was on the forefront of this fight along with a lot of my coworkers, physicians, nurses, respiratory therapists alike, and it was a big learning experience for me. Thank you, Anagha and Atul, for making this happen. So I think I'm going to start now. Today I'll be sharing my experiences because I was active working in the ICU and the ER, taking care of emergencies when the pandemic hit, when it peaked, and when it started to decline. Let me just start with the goal of today's talk. So I will be weaving in my experiences during this period, but also giving you certain facts about this the disease, and basically how we evolved during this process, how we reopened, so that it can help you as we reopen more. It will help you with your decisions as you start to go out more and more. I will be also talking about certain treatment modalities and testing that's been happening right now, what's on the horizon for us, and we will go from there. If you have any questions during my talk, please feel free to send them in, and I will try my best to address them at the end of the talk. So let's start. So my experience basically with this pandemic started on March 10th. I was on call, and what happened was I was actually not supposed to be at the hospital in the evening. And since I had a meeting, I said, okay, let me stay and finish my meeting. And it was not supposed to be me. I was all of a sudden called from the ICU to take care of a patient who was not doing very well. There was not a lot of information available about this patient, but I was basically told that this patient is not doing well, a suspected COVID patient, but the test was sent, but nothing was back, because that was a time when tests were not back very easily. So I was unaware of a lot of things about this patient, but I was called in for an emergency. Being the chair, that was a time when there were a lot of cases, a few cases, I wouldn't say a lot of cases, but cases in the community in different states like California, Washington, New York, and cases were now starting to come into New Jersey, but not too many hospitalized patients. So when I actually went to the ICU, it was a little bit of a surprise, because I saw that a lot of people were standing by, a little tense to go into the room, and not knowing much about the virus. And we really actually did not know if the patient really had the disease. What I saw was the patient was actually coughing up a lot of blood, and looked okay, was pretty with it, but not really doing well from the oxygen saturation point of view. So everything was new. PPE was it was the first time I actually saw what actual PPE meant. So I basically right away went into crisis mode, and I said I had gone over some protocol that morning, So what I did was I started to instruct, and what I did was I said, let only a few people go into the room, and let's not expose everybody. So we decided, just the three of us, myself, a nurse, and a respiratory therapist, to actually go into the room and do what we had to do. We were clad in complete PPE. It was, again, there was somebody to instruct us to do that. We went into the room, and we kept everything ready outside the room. So the goal was to get in, do what we had to do, and get out of there. So we went in, we faced a few challenges, but basically the key was to be calm. It was an out-of-body experience because of the fear of the unknown. We did not know what to expect. We went in. We had decided that we were all going to be calm. There was not going to be any panic, and we did what we had to do, and we left. Since we did not know that this was COVID, and you always think that if there's something bad that's going to happen, it's going to happen to somebody else. We never thought that a community hospital in Freehold would be one of the first ones to be affected. While I was actually working on this patient, there was more information that came in, and the plot got actually thicker. We found out that this patient had actually been with the patient in North Jersey. That was the first one to be critical and hospitalized, and actually critical. And we found out that that patient had actually died on March 10th. So now, and also we found out that this patient had hung out with that patient, and that this patient was a part of a very big family, and they had a big family gathering together. So you must have heard about this family, in the newspapers and also on national TV, because it got a lot of attention. The family was a big family. They had a big get together, and a lot of people were exposed. After I finished what I needed to do on my day of call, I made sure that I informed all my colleagues and everybody that I came into contact that what had happened. We did not know what disease it was, but it was probably COVID. The next morning I was off, but the following day I was on call again. I found out that the patient's mother had gotten admitted, a sister had gotten admitted, a brother was admitted in somewhere in Philadelphia, not doing very well, and the spouses of all these family members were also coming in. So it was starting to get a little hairy. When I was on call so this was Tuesday, I was again on call on Thursday in the middle of the night. I was called in suddenly for an emergency for a sister of this patient who was not doing well. What I saw then was, I would say, the scariest experience of my life. I do not want to give any gory details at this point, but I just want you to have an insight into what this experience was like for all of us. This patient's sister, who was actually doing well a minute ago, had all of a sudden deteriorated. And what happened afterwards, the outcome was not good. And it was, again, an out-of-body and a surreal experience for me, because nobody knew what was happening and nobody knew what to do. That was the time. It was 2 a.m. and I was in a daze. Everybody was in a daze. I was walking around to be able to speak to somebody so that I could share my experience and, get some insight into this. I couldn't sleep. I spoke with some of my colleagues and basically, tried to make sense of this. So my involvement in all of these cases was not only were these patients coughing and sneezing in the room, so they were aerosolizing a lot, and I was going in to perform the most aerosolized procedure on these patients, which was intubation. So there was a lot to handle here. There was fear and not too much instruction. So when this patient's sister did not do very well and actually died, from the next day, we regrouped as a department, and I kind of briefed my department, being the chair, that, this is what is happening, and we are going to start seeing more and more. And my hospital basically got slammed with patients suffering from COVID in the next 2 weeks. It was something that was hard to deal with, but we had no choice but to keep calm in this whole thing and keep doing what we were doing. It was an emotional roller coaster for a lot of us because, again, not a lot of things were known about this virus. Information was just coming out. We were learning with everybody else about this disease, and it was not easy to deal with. I could see a lot of emotions fly high because with my coworkers, because not only are you exposing yourself to this disease, not knowing if your PPE is actually helping you, but you're also going home to your families and exposing them to this disease. So it was not easy on anybody. So anyways, we were getting slammed. We got a lot of patients, but in all this, and what was surreal was a little hospital in Freehold was one of the first ones to be hit so badly by this pandemic that first of all, you had to arrange for all these resources and make sure that you came up with protocols to treat this disease. CDC guidelines were a little confusing at that time, so we had to use a lot of common sense while taking care of patients. As the patients started to come in, we peaked around April 6th, between April 6th and April 10th. And during this adversity, what I noticed was, it was a lot of bad things that were happening, but also a lot of good things came out. Out of adversity came in innovation and a lot of protocols that were put in place, to the point that my hospital had some of the best protocols in the country. A lot of, remdesivir was being used very early on in these patients, which is one of the antivirals which was under study, but not very used very widely. So in this chaos, there was, or I would say madness, there was some sense of order that was created. So I was involved in making protocols to make sure that all these processes were streamlined in the ICU as well as everywhere else in the hospital and the ER, because anytime a patient came in with suspected COVID, not doing well, there was a lot of confusion. So protocols needed to be set up so that everybody knew what their role was. Not too many people were being exposed to this disease, and whatever we were doing, doing it in a very safe manner. There were a lot of heart-wrenching scenes and very sad stories during this time. Patients were in isolation, not being able to meet their families, and it was very sad. Everything was very sad. But I also saw a lot of good things where people regrouped. Nurses, respiratory therapists, physicians, physical therapists, everybody came together and basically became the patient's family and gave patients support. The joy when anybody did well during this hard time was just surreal. And you saw that people were working hard, were exhausted, but still working. And, in this process, some people did get sick. And, again, there was the fear really never went away, and it's still not gone away. But everybody is working through it. We peaked around, like I said, around somewhere early April, and then, then there was a decline. Some surges every now and then because of more community spread, but finally we declined. During all this, all the elective procedures were canceled in the operating rooms, and everything and everyone was actually dedicated to COVID during this time. Slowly in May, I would say that we started to do a little more time-sensitive cases, and that's procedures that can't really wait forever. So we had to now come up with protocols on how to reopen so that we are doing things safely, keeping patients safe, and also doing what we need to do. So patient safety and staff safety was the priority. So we made sure that we reopened safely, and once Governor Murphy gave us the thumbs up to reopen somewhere in June, we are now fully open to do elective cases in a very, very safe manner. So what did we do? I'm sorry, I'm going to be referring to my notes so that I basically keep on track and I am not, deviating from the topic. So, what did we actually do during the reopening process? Everybody was essentially masked completely. We were using N95 masks for the most part, people who are in close contact with the patient, but everybody, including patients, was actually wearing mask. And there was actually in a hospital when you're working on a patient, there is no social distancing. So masks, I would say, was were widely used all throughout the hospital. Hand hygiene, sanitizing all the surfaces. We did make sure that and we are actually making sure that the patients do not, when the patients come in, there is social distancing, meaning there is no crowding anywhere. So, sorry, I'm just trying to adjust my headset here. There is no crowding. So when the patients come in, what we are trying to do is a lot of times they are in their cars, and a lot of practices are doing the same thing too. Patients sit in their cars and they are called in when it's time, and there's social distancing there, so there you will never see any crowding anywhere. Visitors were prohibited. Now you are allowing maybe a visitor at a time to wait for the patient, but essentially you are making sure that there is no crowding anywhere. Uh, so as now we have been open for about more than a month now, and we have developed a routine, and I think everybody has gotten used to the routine of wearing a mask, being very deliberate about all your actions, washing your hands, sanitizing surfaces, making sure that you're not in a closed space for too long. So, and good ventilation, and that is also key. Since New Jersey was hit so hard, there were a lot of guidelines that came out from Governor Phil Murphy were actually very conservative, but they were good policies. So I think having those in place were actually good. So what we are noticing right now, so when we started to do all these elective cases, all the patients were had testing. So all the preoperative elective cases were tested. And what we have noticed, because we are basically testing patients from the community, the positivity rate of these tests is only 1 to 2%. So that is actually very, very encouraging. And so right now, with the routine that we have developed in the operating rooms and all around the hospital, things are working. I did have one of my colleagues who was sick during the peak of this pandemic, but we are all working together, wearing masks, and I, for the most part, do not see anybody sick. So these were some of my experiences during the pandemic, and I mean during the peak of the pandemic, and also during reopening. So what have I actually learned during the lessons that I have learned during this whole period? First, the first lesson I have learned is masks work, and reopening is absolutely doable if the disease in the community is low. Everybody wears a mask, and we follow the rules. So basically, avoid crowds. Outdoors is better than indoors. Hand hygiene, and staying at home if you're sick. If you follow these guidelines, I just think that reopening is absolutely doable. So, what are the things you can actually do when things start to reopen more? Reopening gets harder when the disease in the community is high. So if you really see, if you're looking at things on the internet, New Jersey, there's something called as the transmission rate. A transmission rate below 1 is a good thing because when it goes above 1, what it means is one person can be infecting more than one person. So you want to keep the transmission rate below 1. Right now in New Jersey, it is 1.48, I think, as of this week, which Governor Murphy is not happy about. But in my opinion, if this could be because of increased testing. We are testing a lot more people right now. But also, I feel like, you know, I'm sorry, I think there is an issue with, okay. So in my opinion, when the hospitalizations start to go up, that's when you see it's an actual problem. When you see that patients are actually getting sicker. So what actually determines if, and what I have noticed during all this period, the patients that came initially, in the initial part of the pandemic, were very sick. And I think that is attributed to a very high viral load. So think of it this way. If you are in close contact, or even now, if you are in close contact with a person who is sick without a mask, the viral load is going to be high, which means that you are going to get sicker. So the severity of the disease is determined by 1, the viral load, and 2, it is determined by the patient's ability to fight the virus. So if you have an immunity which is compromised because of medical issues, your capacity to fight the virus is going to go down. Also, if you are out and about in the community where already the disease is high, or even if the disease is low, and not wearing a mask, in close contact with somebody, indulging in activities like contact sports or parties where you are dancing and singing and breathing heavily on each other, it's a problem because you are going to spread the disease, the viral load is going to be higher, and you are going to be sicker. So masking is the key. My suggestion to people is mask up. Make it a way of life. It is hard. I, in the OR, wear an N95 for sometimes 8 to 10 hours at a stretch. And it is not the regular N95. It is the hard molded N95, which is painful. I'm not going to say it's easy. It is exhausting. I'm exhausted at the end of the day, but I don't think we have a choice. If I can do it for 10 hours at a stretch, you can certainly wear a regular mask and move around. And I am almost certain that this will prevent the disease from spreading any further. You have to always remember, if there is no host, there is no virus. The virus will eventually die. So this is the way of preventing the spread. So what is important here is the things that you can take away from my talk today is personal responsibility comes first. I always give an example. I personally, I like to dance. So my analogy is anytime there is a group dance, right? If there is no synchrony, the dance doesn't work or looks horrible. If a person says, okay, I'm going to follow the person next to me, I'm going to look at that person and try to synchronize, it's too late because there is always going to be a lag. So as long as every dancer gets an understanding of the rhythm and the beat, and the dancer does his or her part, it synchronizes automatically. Everything falls into place and the dance looks beautiful. Same thing here. Do your part. Wear your mask. Don't be embarrassed to wear your mask. I mean, I am guilty too. I have been at backyard gatherings of small people. I usually don't go to big gatherings. And you are human. You get carried away. Somebody is not wearing a mask, and then you start to get closer, and then you say, okay, this person doesn't really have the symptoms, doesn't have the disease. And, trust me, I have come home and really felt guilty about my own behavior. And I tell myself that, wear a mask, don't be embarrassed, be polite and tell somebody else to wear their mask and wear it appropriately, not below the nose, so that we can actually help control this disease. So don't be afraid to wear masks, and take personal responsibility and do what you need to do. I'm just looking at my notes further to see if I can give you any more information on that. So I think for reopening tips, all I can say is follow the rules. It's everywhere on the internet. I'm not telling you anything new. Social distancing, sanitizing, avoid indoors as more than outdoors. When you're indoors, mask up, keep your distance. Once you start going to offices, you can still do it. Keep your distance. And make sure that you are not spending too much time in close contact with somebody for long periods of time. Just wanted to give you now some information on what the treatment modalities were when we were treating patients at the hospital. What worked was actually COVID has been seen to cause a lot of coagulation problems, meaning it makes the blood thick and causes issues like strokes. You must have heard of something called as COVID toes, heart attacks, and making the blood thinner with the help of anticoagulants has helped a lot during this process. So anticoagulants, steroids, the antiviral remdesivir has helped a lot, and convalescent plasma, which is the plasma that is recovered from patients who have gotten over the disease, that has worked and shown some promise. What's on the horizon in terms of cure is monoclonal antibodies, meaning plasma actually gives you antibodies. Now they're trying to make antibodies more specific to the disease. A lot of antivirals are being tested for cure, and since remdesivir has shown promise, but it is an intravenous medication at this point and only approved for moderate to severe disease, what is being studied is inhaled remdesivir, so that it's not far advanced in the studies, but it's still being studied so that we can try and target patients when they come to, say, the urgent care or go to a primary care, so that people can get the inhaled remdesivir. Again, it is being studied and it is not yet out. The most important thing I think everybody is going to be talking about now is vaccines. So a little bit about the vaccines. So a lot of pharmaceutical companies all around the world are trying to make vaccines. They are targeting different parts of the virus and trying to make different vaccines. There has never been any push, this much of a push for making a vaccine in the past. So I think the push to make the vaccine is a lot right now. And I think, in my opinion, okay, I'm not going to, there are no guarantees here, but in my opinion, you will see something probably by the end of December or early next year. The vaccine, there's some pharmaceutical companies are more ahead than the others, and I'm sure you're hearing this on the news about these vaccines. Now, a lot of people are afraid to take this vaccine, right? I mean, there are a lot of questions about, should I be really taking the vaccine? Because normally a vaccine would take 18 months to 6 years. And should I really be taking this vaccine? Because I'm not sure about its efficacy and also about the safety. So every time a vaccine comes out, there is a safety profile that needs to be studied. And I am sure all the experts from all around the world, the medical community, will be challenging the safety profile of every vaccine. And there will be a lot of information out there for all of us to study about these vaccines. So what is important when the vaccine comes out is, don't make a decision right off the bat that I will not take the vaccine. Do your own homework. study the vaccine, study the safety profile. There will be a lot of information on TV and newspaper and everywhere. So be open to all of this, and because this is what I am going to do. I'm going to do my homework, and when I think it's safe to take the vaccine, I will take the vaccine, because I don't think there is a way out of this without the vaccine, a proper cure. But until then, my advice to everybody would be stay safe, follow the rules, and do what needs to be done. Don't stop living your life. Go out there. Don't be afraid that if I get out, I am going to get the virus. You can get out in a safe possible way by wearing a mask, maintaining the rules, and you should be fine if you do all these things, because I go to work every single day, and I've been doing that ever since this pandemic started. Knock on wood, I have been good so far. My colleagues have been good so far, and this has become a routine for us. So I think I'm going to end my talk here. I hope I was able to shed some light and give you some insight into how you can use my experience to reopen when things start to reopen in your state. And with New Jersey, everything is starting to reopen. Things have been delayed a little bit because of the uptick of numbers, but hopefully we can control that. Thank you very much. And I think I'm going to take questions if there are any, and we can go from there. Okay. So Kalpana is asking me to summarize the precautions that we have to take during this when you reopen. So first of all, I would say wear a mask. Wear a mask, hand sanitization, sanitization of surfaces. So make every action deliberate. What I've also noticed is stop touching your face, because I realize that what we do in our everyday life is we touch our face a lot, especially when you're outside. So when I go grocery shopping or when I go to work, the first thing I do in the morning is wear my mask. And when you wear your mask, you're basically not touching your face. But every now and then you have to take your mask off to be able to breathe properly. Make sure you do not touch your face, because you do not touch your face, the virus is not going to get to you. So wear your mask, keep at least a 6 feet distance from the other person. If you're indoors, sometimes it's not possible to do that, so definitely wear a mask when you're interacting with somebody. Do not be in one place for too long. So do not be in a closed room. I would say if you are listening to a lecture or you're in a meeting, do not be in a small room. Make sure the ventilation in the room is good. So, maybe crack open the windows so that you can let some air in and, help with the ventilation. So that is one thing I will definitely tell you. But hand sanitization and masks are a must, and absolutely follow those. So Nilesh is asking me a question about the mortality rate. He's saying that the mortality rate seems to be going down. Is it because we know more about how to treat various issues that this disease brings? So, like I said, in the midst of all this chaos, we have finally, in the middle of this madness, we have developed a kind of an order. So there are protocols in place for mild disease, moderate disease, and severe disease. And like what I said before, what has worked is anticoagulants, remdesivir, plasma, and steroids. Steroids, initially they said that do not use steroids, but now they're saying that steroids have actually prevented patients from going on ventilators and helping them breathe better. So if you look at the virus, the way it causes the disease is locally it affects the lungs, and it will cause destruction of the lungs and cause the disease. But it also causes the disease by evoking a kind of an immune response in some people where it can affect all the organs. And the third way it can affect is making your blood thick and causing a hypercoagulable state, meaning thickening of the blood, and the blood gets thick, so the blood flow to the organs reduces, and it can affect the organs. So now if you're trying to treat the disease take care of this virus at every stage, meaning at the level of the coagulation problem, at the level of the immune response problem, and the level of the lungs. I think that is what is being done right now, and that is why you have better control of the disease. Also, I think the viral load is very important. There is something Ashutosh just said to me about, because there's a question about the cytokine storm. I think the immune response, what happens is there's something called as a cytokine storm. So sometimes the immune response to fight this virus, and especially young people, is so strong that it releases cytokines, which now affects all the organs. So sometimes you have to give drugs which are actually called interleukin-6 inhibitors, which actually make this immune response a little bit less, so that it is not affecting all the organs. So since we are attacking this problem from every end, that is definitely something that has worked. But I also think that the viral load is most important here. We got patients in the initial stages who were very sick because there were no masks. They were in close contact with each other, and nobody knew about it. So they got very, very sick. Now, even though some people are refusing to wear masks, I think the level of close contact that people are having with each other has gone down a little bit. So also the disease that is presenting is not as severe as before. So I think that's mainly one of the reasons. Anu is asking me, I need to travel to work in a public train or a bus starting September. How safe is it, and what is your advice on taking public transportation? So I was doing when I was doing my research on all these different topics, it's important to learn from what other countries are doing. What other countries are doing is, there are places where countries where public transportation has started. The 6 feet distancing is definitely a rule. So first thing is masks. Second thing is prevent overcrowding in buses. So either you use your own private transportation, or if you have to use public transportation, you make sure that the buses are not crowded. So in some places, the capacity of these, say a bus, has been reduced to 1/4. So obviously you will need more buses to run that way. So that's definitely one way of doing it. Crack open the windows. Don't be in a bus or a train for prolonged periods of time. I wouldn't travel anywhere with people, say in a bus or a train, if I don't have to for a period of 3 hours. An hour-long bus ride is fine. Crack open the windows. Wear masks. Keep your distance. Again, sanitizing surfaces, sanitizing your hands. Do not touch your face. These are important measures that you can take, and I think employers should also have some flexibility of time. So all the people are not traveling at one time. So travel during off-peak hours, or those concessions have to be made, and those arrangements have to be made. Another question is there any possibility of, Sonal is asking this question, is there any possibility of a second wave in New Jersey in the fall? So the way I look at it is, right, when they talk about waves, I don't think there is going to be a wave. I don't think until the vaccine comes in, or we have a cure, I don't think the virus, the number of cases is going to go down to 0. As we reopen more, you're always going to have a little bit of a surge here and there. If you want to call that a wave, that's fine. But if we don't accept our own responsibility, if you have a surge, and this has happened in other countries too, you have a surge, You isolate the people who have the disease, you do contact tracing, you isolate the people who have actually been exposed to that disease, and that is how you control the disease. If you don't do that, if you don't wear masks, if you don't take personal responsibility and do whatever you want, it's not going to work. And then you can call it the second wave, and then we are going to go right back to what happened in March. So I think we will have clusters of cases here and there. If we do the right thing, it can definitely be controlled. Be deliberate about all your actions. Be aware of what is going on around you. And I think what will happen is we should be able to control things. I don't think the way things are going, I personally, because people are more and more aware, I personally don't think things will shut down completely like before. If we can make sure that we do our part and do whatever needs to be done. So I think that's my input on that. Sandhya is asking, people with antibodies, do they pass on the virus? So the antibody question is, you have to explain a little bit. So anytime you contract the virus, right? So you contract the coronavirus, the body responds by producing two types of antibodies, and they are called IgM and IgG antibodies. So and that is how the body fights the virus. So the IgM antibodies are produced in your body somewhere around day 5 of the infection. Okay, and the level of these antibodies goes down around day 14. Around day 14, another set of antibodies comes into the picture, and those are IgM antibodies. And these are antibodies that actually will protect you from having the virus again. So basically, when you have IgM antibodies, you are actually having the disease because you are within 14 days of the virus. So either you can have symptoms, or if you don't have symptoms, you're still having the virus because your body is fighting with the IgM antibodies. So an IgM antibodies means you have the virus and you're probably infective during that period. When you do not have IgM antibodies and you only have IgG antibodies, it is basically telling you that you've had the disease in the past, okay, which is beyond 14 days. So the question right now is, are you immune to the virus if you have the IgG antibodies, no IgM, just IgG antibodies? Are you immune to the virus and you can actually go out into the community without getting the virus? The answer to that is nobody knows. There are still studies going on about this, about the IgG antibodies. First of all, you don't know if the IgG antibodies are going to last forever. Considering the coronaviruses, actually, the coronaviruses can evoke an IgG response anywhere from 3 months to 1 year. So nobody knows if it is going to be our regular flu virus, which comes back every year, or it's going to be like a common cold, which is going to keep coming back because you're never going to be immune to it. The immunity lasts for a short period of time, and that is why all these studies are being done to see if the the antibodies are actually going to work. But yes, if you have IgG antibodies, you will have some level of immunity. So that is why these antibody tests are actually done, to determine what kind of antibodies you have, IgM or IgG. So this is a little bit complicated. I hope, Sandhya, whatever I explained kind of helps you. The next question is, what precautions will you suggest for teachers? So, this is a big question now, and I think Sonal asked that question. To me, I am an essential healthcare worker, right? So I was needed during this pandemic, so I showed up to work every single day. I took the precautions. I also, and this is my own personal opinion, I also think that teachers are essential workers from now on for the mental health, for the mental well-being of our children. And it is absolutely doable. So if you reopen, you follow all these measures, right? You follow measures like, again, masks, social distancing, not too many children in the room. Again, uh, short classes, outdoors better than indoors, cracking open the windows. You are actually reducing the risk. And again, temperature checks. Temperature checks when the kids come in. Symptomatology, meaning who is sick. If you're sick, kids cannot show up to work. So you're reducing the risk right there. And everybody, again, is masking up. The teachers themselves absolutely have to wear a mask. You also have eye shields. You can have these eye shields that you can wear because it's been shown that virus can actually get in through any kind of mucous membrane, so through the eyes through. So you can have a shield and a mask. You can have a plexiglass barrier in front of you when you are talking, because when you're talking in a class, you're talking loudly and you tend to aerosolize. So you can have a plexiglass barrier in front of you. And again, be deliberate about your actions, and it is absolutely doable. Is it going to be hard? Yes, it is going to be hard when the kids go back to school, but if you can keep your numbers low at any given time and you follow the rules, I personally think it's doable. I hope, Sonal, that answers your question. So I have a question here. It says, from Sarita, will it be safer now to send kids to school, assuming that there will be implementation of strategies to maintain healthy operation with reduced capacity? Please advise. So again, just to add to the previous question, I'm faced with the same problem, right? My kids will probably be going to school. Again, reduced capacity in schools, implementation of all the strategies, being deliberate about wearing those masks and deliberate about every action. It can absolutely be done. Kids are going to be kids, so I think there also should be people watching kids' behavior. So it's going to be harder in little kids. It's hard to tell them what to do, but as you get older, I think you should be able to tell kids what to do. And as there is more understanding of the virus, kids should be able to comply, and I think it's doable. I will be sending my daughter to school if I think the school is abiding by all the rules. Sarita is also asking, even after the vaccine comes out, how much time will it take to reach the common people? Will it be available immediately after it comes out? We don't know. So what is happening right now is there's research going on everywhere. The vaccines are being studied. The trials are happening. Some companies are also producing the vaccine at the same time as these trials are going on, because if you see more promise in these trials, they are actually producing the vaccine. So if the trials fail, everything will be wasted. But I think the manufacturing is happening simultaneously, but it is going to be a challenge. First of all, the vaccine comes out. Then people are going to decide if they are going to take the vaccine or not take the vaccine. And then to make it available to everybody. We don't know if it's going to be available to everybody right when the vaccine comes out, but you saw how what happened with testing. Initially, the testing was so low, results, there was a backlog, results were coming back late. I hope we have learned from that. And when the vaccine comes out, and if people want to get it, I think it should be made available as soon as possible to people. So long story short, we don't know, but I hope work is being done. Sonal is also asking, is it necessary to clean all vegetables and fruits from grocery bags? So in grocery bags. Oh, and grocery bags. Okay, sorry, my husband's correcting me. What I think is when the disease actually started in March, correct? And we went grocery shopping, we got things. When again, the disease is more in the community, you have to take extra care. There is no evidence that the disease is spread through water or food. Having said that, if you are, say, buying apples, you will absolutely have to wash the apple before you eat it. You are buying vegetables, you are going to cook those vegetables. If you're going to eat raw vegetables, you have to make sure that the vegetables are washed. The guidelines have been relaxed a lot now because the disease in the community is low. So when actually the disease started and I got groceries, I was making sure that everything was cleaned from the outside, not the I wasn't cleaning the vegetables with Clorox, but I was cleaning the grocery bags and everything. I have stopped doing that because the guidelines have relaxed, and because the disease in the community is low. But then I was even trying to clean cardboard surfaces. So you go get pizza, I was cleaning the cardboard boxes. But right now we are actually a lot more lenient with these guidelines. Okay, one of the questions is from Bhageshri. My 8-month-old niece is admitted at the Children's Hospital. My sister wants to ask what care to take when being admitted to the hospital and being, what is this? And being the caregiver for infants. So the 8-month-old child, I'm not sure if you're saying the 8-month-old child is admitted with COVID or with another disease. But if you're saying that from the data, it definitely shows that kids are a lot less affected by this disease. They can be carriers, but if you're talking about an 8-month-old being admitted with the disease, the caregiver, you cannot leave the infant by themselves. So if I am taking care of a patient, right, this is what our nurses did. They were taking care of the patient. They were all gowned up. They were using masks. They were using gloves, or even if they were not using gloves, they were making sure that they were washing their hands frequently, sanitizing frequently, and wearing masks at all times. So those are the things that are basic, and it's everything that you do. I have realized over the last few months, it is common sense. This is a respiratory virus, so everything that makes sense to you, do it. And you can actually get your lives back to a certain extent when you follow these guidelines and get some security that what you're doing is right, and these masks work, and you can actually socialize a little bit if possible. And of course, if you're taking care of the infant, these are the things you should be following in the hospital. Okay, so I think just to follow up on the previous question, I think the infant has eczema. So the child is in the hospital. Again, the same things apply. Take care of the child, but make sure you follow all kinds of hygiene, hand hygiene, surfaces, masks. You can't follow social distancing from an infant, so it is what it is. Also remember that in the state of New Jersey, anyone can get tested now. It doesn't mean that you abuse the system where you just get tested just because you want to. But if there is a situation where you have been in a big party and you find out that somebody was sick and now you're a little nervous, New Jersey has the ability now to test whoever wants to be tested. So it is definitely a possibility. We have another question. Neeta is saying, what is the protocol for non-COVID patients scheduling their routine checkup appointments? Do they have to be tested first? So, Neeta, there are two categories, right? One is your regular checkup appointments, and then I do want to say that now that the disease in the community is low, do not ignore your health or your non-COVID problems. Practices have opened up very safely, so schedule your appointments. A lot of times you are not even allowed to wait in the waiting room. You're waiting in your car. You're filling out all these questionnaires online, and then they call you from the office. when you're in the parking lot, you call you in and you can get your appointment. So I just recently had my own mammogram done because that is not something that you're going to delay. And I was very impressed by the way things were handled. I was not close to anybody. I wore my mask. I did what I needed to do, and it is done very, very responsibly. I don't think you can get tested, or a test is mandated for a regular appointment, because if you take all these precautions, you're fine. You don't need to have a test for a regular appointment. If you need to have surgery, an elective surgery, the state mandate is to test everybody that comes in for an elective surgery. So every hospital has different guidelines, but the state mandate is you test everybody 6 days in advance. Because of the backlog, ideally it was 3 days, but now I think 6 days is acceptable. You test every person who comes in for an elective surgery 6 days before. You quarantine for the next 6 days, meaning you avoid contact with or avoid being in a situation where the likelihood of getting COVID is high. And then you come in, questions are asked, temperature checks are done. If you have no symptoms, and you should have a test result by the day, or by the time you are actually coming in for surgery. And that's how things are being managed right now. So my advice to everybody is absolutely get your regular appointments and don't avoid anything, because I have seen bad things during this period from non-COVID situations where people have ignored things and come up with life-threatening emergencies. So please don't do that. Mandar is asking, do you find repeat infections where people are readmitted? I don't think we have found that in my hospital, but if you see around the world, some countries have seen certain repeat infections, not a whole lot, but like I said before, there is not enough proof right now that the IgG antibodies that are found in your blood after you've had an infection will last for more than for a long time. So we do not know that. So which means that even if you have had a past infection, you have to assume that you are not immune to it and you can get it. So you have to follow all the precautions. Preeti is asking, how safe is restaurant takeouts? I think it's relatively safe, as long as you think that the restaurant that you're getting food from is maintaining hygiene, meaning, there's not a whole lot of ways to find out if that restaurant is, to find out what is being done in the kitchen. But like I said, COVID is not transmitted through food. So you should be fine. This evidence is, of course, not 100%. Nothing is 100% right now. But for the most part, it is not transmitted through food. I have been getting takeouts in my house all the time, and we are doing well. So takeouts is absolutely fine. Makarand is asking, will there be a cure to COVID in the near future? Well, I hope so. Right now, like I said, I don't know if you attended the talk from the beginning, but I was saying there's a lot of research being done on antivirals, different kinds of antivirals. The antiviral that is being used right now and that is showing promise is remdesivir. It is only intravenous. There's a lot of research being done on trying to make inhaled remdesivir, so that when a patient comes to a primary's office with symptoms, you can actually give the person inhaled remdesivir, and that could be a potential cure. Is this definitely going to happen? I don't know. Does remdesivir work all the time? No, because it also depends on how much the virus has overwhelmed any person's immune system. So, but it has definitely shown promise in severe disease and moderate disease. So that is definitely looked at. I hope, Makran, that answers your question. Sonal is asking, what about indoor events? How safe is it, and what precautions to take to make your guests feel comfortable? So indoor events, if you ask, so every state has guidelines for the number of people you can entertain outdoors and indoors, right? So you definitely have to follow those guidelines. Please do not go over the number. But if you ask me for my personal opinion, I am not very comfortable going indoors because of, again, it's a closed space. Ventilation is a big factor in this. You are in one space. If you are spending a lot of time in a closed area for long periods of time, and you should know that the incidence of asymptomatic patients, according to studies, is anywhere from 18 to 40%. So that is a risk. I wouldn't say that asymptomatic patients are the maximum spreaders, but if you are having close contact with a person who is an asymptomatic patient, there is absolutely a possibility that person can spread the disease. So I would say, as far as possible, avoid indoor events. If you do have some event which is indoors, make sure that you have less number of people, a few families. Don't be inviting 50 plus people, because it's a problem. I think the limit right now is 25. So like I said, I'm not comfortable with indoor events. Ventilation has to be good. The virus cannot stay in the same place for too long, because then you run the risk of getting infected. Indoors, mask absolutely a must. I work indoors for prolonged periods of time. I wear a mask. A lot of us have been safe for the longest time. And just to reiterate again, masks do work. Sarita is asking, can you highlight the role of home pulse oximeters? So that's a good question, actually. And just to let you know that, I bought a home pulse oximeter for myself and my family the peak of this crisis. So it's not a bad idea to have something like that at home, because say you have you get infected and you get the virus. Not the symptoms are not too bad, but this virus has shown to be very unpredictable. So one day you are okay, the next day you start to deteriorate. So it is a good idea to have a pulse ox at home, where you can actually keep checking your oxygen saturation during the time that you are sick, and monitor yourself. So you think you are feeling a little short of breath, or you don't feel good, and you look at your pulse ox and correlate. That can actually help. So I would say I bought it. They are not very expensive. You have portable ones. You can absolutely get one, and it is another level of security. Anagha is asking, traveling out of state. I know a lot of states are out of bounds currently. Is it safe to travel by car, staying in a hotel, etc.? So just from personal experience. So recently, me and my family, we did have a short vacation. We went to Long Beach Island for a week, and then we went to the Berkshires in Massachusetts for a week. And again, follow the rules. It is absolutely okay. First of all, you choose a state where the disease in the community is low. Don't be going to Florida right now, or don't be going to a state where the disease in the community is high, because then you have more people who are sick around you, and the likelihood of you getting the disease is higher. We went to Massachusetts, and we went to LBI is in New Jersey. So what we realized is, we had we booked something on Airbnb, and as long as you make sure that everything is clean. So, we went in, we sanitized all the surfaces, we used our own linen, and we stayed within our family. We went for bike rides. We went to the beach, which was not very crowded at all. We stayed in our own pod, away from people. And we also did some outdoor dining in places which we thought took a lot of care, and it was absolutely fine. We went to the Berkshires. I noticed in Massachusetts that people are extremely good with masks, where people will be in masks when they step out of their cars. And people are a lot more diligent than what I saw in New Jersey. So it was beautiful. We went on hikes. You're by yourself. You're going in. It's not that yeah, in open spaces you're going to find it all in the air. You are in open spaces with people that you are spending time with every day, and you're fine. You can absolutely go hiking and indulge in activities, but follow the rules. Outdoors, if you're out in the open on the mountains with a lot of people around you, there's no need to wear a mask. But if you feel like there are people around you, and go ahead and wear a mask, and then everybody feels safe, and you also get that sense of security. Hemlata is asking, is it safe to send kids to school from this September? I mean, I did answer this question before, but I'm going to say it again, that you have to first see what rules and regulations the school is coming up with. You do your homework and ask questions to your school district about what they are doing to make sure that they abide by the regulations of the state, and what they're actually doing to keep the kids safe. So, reduce number of kids in every class, different times for kids, so that all the kids are not in the school at the same time. Shorter classes, outdoors more than indoors. Cracking open the windows when you are in class, wearing a mask at all times, temperature checks. If all these things are being done, if they are watching, making sure that student behavior is appropriate, somebody's keeping a watch on that, I think you should be okay, sending your kids to school. Just based on some research from different countries, what other countries have done is precisely this: smaller classes and different times, a hybrid of virtual and in-person learning, and making sure. And what they are suggesting is every school come up with a 4 to 6 week plan for the schools, because there will be occasions when somebody falls sick, and then it's a scare. So you have to be able to, it is a dynamic situation. So you have to be able to change your plan on the fly, and make provisions for that. So if you start to find that somebody is sick, and now the school is saying, okay, now we need to take a break, so we'll do virtual for a little bit, and then you come back. So do your homework, ask a lot of questions to your schools. And just so you know that I am going to my daughter's school, she's in 9th grade now. It will be reopening. They have a hybrid of 1 week on, 1 week off, between remote and in person. And I do intend to send her to school. So I hope that answers your question. Any more? I think there is one more question. Give me a minute. Okay. 1 second. The question is, would it affect the overall immunity of kids who are perfectly healthy with no pre-existing conditions or allergies if we keep them away from exposure to outdoors for a long time? I'm not exactly sure what this question. Okay. So, I mean, you always, I don't think it will impact their immunity, but being outdoors is always a good thing for anybody, right? It is good for your general health. So being outdoors is a good thing. Do not make your kids, make sure your kids are not cooped up in the house all the time. Let them go out. If they're playing with their siblings, let them do that. If they are, some people have formed pods, right? So as long as you know what the behavior, if say you form a pod between say 4 friends, you have to, I mean, there is some risk involved there, but you should know what the behavior of that family is, or the behavior of those kids is. If the families are going around meeting a lot of people or partying, you have to be careful, because you don't, there are too many variables here. But if there is a family like yours that is taking all kinds of precautions and making sure that they're wearing the masks and keeping it, then some people have formed pods. My own my own kids have formed pods, and things have been working. I mean, they have been good. So I don't think it's a good idea to keep kids indoors all the time. It doesn't really affect immunity, but being outdoors is good for your soul. So definitely make sure kids are outdoors. I hope that answers your question, and I hope I got your question correct. I think that's the end of questions. So, I just want to take this opportunity to thank Marathi Vishwa again. It was a lot of fun for me to share my experience over the last a few months with you, and the main goal of this talk was to make sure that I can help with your decisions in the future as we start to reopen more. Thank you, Anagha, for reaching out to me, and thank you very much, Atul, for making this happen. Thank you, Marathi Vishwa, for giving me this opportunity, and I really hope that you benefited from this talk. So stay safe, but live your lives, yeah, and live the new normal for a little bit. Make masks a way of life, and I am sure everybody will be safe. So thank you very much.